Hey, Succeed with your new knee group. My name is Dr. Alex Conway, and I want to talk to you guys today about some of the reasons your knee has decreased range of motion after your knee replacement surgery, and discuss briefly about how to address each of these components. So the knee relatively is a simple joint, but it can be quite complex when trying to improve your range of motion. So starting off, let's talk about a few of the contributing factors of why the knee is difficult to bend or straighten after surgery. When I think about this with my patients, I'm thinking about how all these factors play into knee stiffness. And that directs my multifactorial approach into rehabbing a knee. There's no one approach fits all. It's looking at each one of these, factors and seeing which one is contributing the most, and so on and so on, and addressing each of these factors. So, what these factors are. So, I'll talk about 4 of them here. First is inflammation. Okay. Second is muscle tightness or tone. Third is joint stiffness within the joint. And fourth and finally, pain. Okay, let's start talking about inflammation. So after surgery, there is a significant amount of trauma, caused to that joint. So this causes inflammation within and outside of that joint. We often think that inflammation is bad, but inflammation is actually a healthy mechanism. Our body knows what it's doing here. So inflammation opens up the blood vessels. It sends in and allows those highways through the blood vessels to bring in good nutrients. It also takes away, dead cells and things that are already used there, cleaning up that process right there. It also tells us that our brain that we are healing. So it contributes to pain signaling and stiffness here. So remember, these are healthy mechanisms that, tell your brain, hey, let's take it easy for a while our body heals. However, during knee surgery, after knee surgery, we find that this can, get in the way of improving your range of motion, which we know is really important in the first few months. And then after that inflammation process is done, we tend to stiffen up. So we have to start improving our range of motion while we're still in this inflammation phase. So managing inflammation is really important in achieving those range of motion goals. And as inflammation decreases as the weeks go along, we start to see an increase in range of motion as well. So what do we do to manage inflammation? Well, ice. That is the first line of defense. I absolutely love it when my patients either by themselves or insurance or their doctor's office sends them home with one of those ice machines. Ice machine is it's a cooler with a pump, and you put some ice into it, and there's a strap that wraps around your knee, and it continuously pumps cold water in there. So you should leave ice on at least 20 minutes every few hours for the first few weeks. Most people don't need to be told this. They want to do it because it makes them feel better and takes away some of that pain. Many people ask me, how long can we leave ice on? I really don't have a hard rule. Now, I don't really suggest leaving on the ice machines, on all night and sleeping with it on. But I have some patients that do it, and there's nothing wrong, no side effects from that. I would say, a good hour is probably good, but you're not going to hurt yourself if you leave it on for 2 hours or delay any healing at this point in time. Just make sure if you're using ice bags or something else like that, have a layer between, the ice and your skin. Don't want to be leaving ice on too long and getting frostbite. because of the ice directly on the skin. So second, compression socks. Compression socks, nobody likes them. They're usually given to majority of my patients after surgery, but I'm seeing some surgeons not give it out at all anymore. First line of defense is it helps prevent blood clots, especially as we're more sedentary after your knee replacement. We get a little bit less movement, and movement pumps blood and inflammation outside. So doing ankle pumps and walking are all great things to manage inflammation. Compression socks really just squeeze everything, so it doesn't allow that inflammation to accumulate. After a few weeks, some of my patients opt to continue with compression socks, but they might get something a little less tight and something that just goes to just about underneath the knee. And they tend to really like it, and tends to help them put on their shoes a little bit easier and takes that inflammation outside of the lower leg and knee. Third, elevation. I see a lot of people in my patients not doing this correctly, and we need to do it correctly because it's important we use gravity for our advantage. Gravity is always pushing everything down, and that goes with our inflammation too as well. You might see after surgery that your calf or something in your lower leg is bruised, and that's because it kind of goes down further into the leg. Often see swelling accumulate in the foot and the ankle. So as you're icing, make sure you get that knee and that leg above the heart. And that's going to help drag that inflammation with gravity in the other direction, so your body can get it out of that area right there. Medications, doing the appropriate dose of exercise at the right time, and standing and walking are other important factors of managing inflammation as well. So moving on to the next contributing factor, let's talk about stiffness in the joint. So what I'm referring to here is stiffness in the joint capsule, the ligaments, and the surrounding tissues that doesn't involve the muscles. This also includes scar tissue that forms around the joint after surgery. So this is a knee here. Okay, this is the outside of the knee, front of the knee. Now, your knee's not going to look like this. You're going to have some nice shiny titanium, but around this knee there's a capsule, kind of a cuff right here that stretches and bends, and often that is stiff and tight after surgery. Some of the surrounding ligaments and tendons can get stiff as well after surgery. So after, to address this in therapy, I often use passive exercises. What I mean by passive is that you move your leg with your muscles, but you can often move it more without using your muscles. We call that passive range of motion there. So I often have my patients use a belt and hold their knee and pull their ankle towards their butt and hold their knee, bending on a stair. And your therapist might be pushing down on your knee to straighten it, or bending with his or own hands, or kind of doing some oscillations and rocking. This helps address the joint itself, and can help break up scar tissue or prevent the scar tissue from forming. Actually, scar tissue is really hard to break when it's formed. Some studies, say it's strong as steel, once it's fully established there, and that can limit how much we can move it. So that's why by 8 weeks, that scar tissue really, starts forming a little bit more aggressively and getting a little bit stronger. So that 6 to 8 week line, we really want to try to achieve as much range of motion as possible. Afterwards, it is possible to get, range of motion, but what I see is it takes a lot more effort, and the improvements are a lot smaller after that point. So that's why it's really important that we push through pain, push through the discomfort in the first, 2 months here, by the time we're outside of the inflammation phase and we're not painful, it's going to be hard to improve that your range of motion. All right, so let's move on to the role of our muscles in range of motion. So this can be a complicated topic, but it comes down to this. After surgery, your muscles become tight, weak, and painful. The body goes into protective mode, and that involves your muscles tightening up. So we have three main muscles that are often the culprit. One, the quadriceps, that front thigh muscle. Two, your hamstrings, the back of the thigh muscle. And the calves. But the calves tend to not impact a range of motion as largely as the quads and the hamstrings right there. So the nervous system drives all this tightness. Your muscles didn't suddenly get short and now they can't expand. Your nervous system is telling them to be tight and protect your joint right there. So we find the quad and the hamstrings have a really close relationship. And this is important. When the quads contract, the hamstrings need to relax. And so they talk to each other. So you don't have the quads pulling and the hamstrings pulling and they're fighting against each other. So after surgery, you may find that it's hard to turn on that quad. Lifting your leg up, it just may feel heavy, it may feel weak. You might even find difficulty even just trying to find how to contract this muscle. So this is also a big reason why the hamstring has a hard time relaxing, especially when we're trying to get that full straightening. The communication with the quadriceps is fuzzy and it doesn't get those strong signals to turn off. This is one of the reasons why strengthening your quad is going to be a really big theme throughout your journey here. So what do we do with muscles that are tight? Well, you can stretch them, you can massage them, you can use heat, and you can strengthen them. That strengthening point is often ignored, but happy muscles are strong muscles, and strong muscles are typically less tight. So a few points here. Make sure that you're stretching at a moderate intensity for long duration. Research really says 45 to 90 seconds many times during the day, but really we can get away with 2 to 3 sets of 30 seconds to a minute majority of the time. Heat is also really good. Just imagine if you have stiffness in your neck, you take a hot shower, put a hot pad on there, loosens it up, takes away some of that intense tightness. Make sure you put the heat on the muscle and not on the knee joint itself. And lastly, massages, okay? Massaging that muscle can be really effective as well. I do it in the clinic. I often see it overutilized and I often see it underutilized. I think there's a happy medium in deciding, who needs it and how much of it. Often I have a lot to do and educate and get done during the clinic. And doing a good massage to really release that muscle takes some time. So I will teach my patients how to do themselves, and I often recommend my patients go get a professional massage. I've never had a patient who gets a massage and says nothing but how much it helped them, how much it loosened them up, helped them achieve their range of motion goals, in addition to the massages we do in the clinic or at home. Massage guns can be comfortable for some patients too, so that's an idea. Alrighty, to my last and final point here, wrapping things up. Pain can limit your range of motion. Nobody likes pain, and we tend to avoid it. When we feel pain, your muscles tighten up and they guard against that movement. So it's really important that you're managing your pain, staying ahead of it, with your pain medications, using ice. Make sure you're doing the appropriate exercise intensity. Pushing enough to, achieve those goals, but making sure that we're not overdoing it where we're constantly in a lot of pain and inflammation. And important that we're, managing our activity levels. In the beginning, I had to pull the reins on some people that want to, start walking a few miles within the first few weeks because they were doing that before. Often doing too much too soon can increase in pain, and often doing not enough at all can do the same. So I call it kind of the Goldilocks balance right there, finding that sweet spot as you heal. That sweet spot changes along the process here. Alrighty, so that about limits some of those contributing factors that limit your range of motion, and a few tips how I address these with my patients. So to get a review, it is inflammation. It's the tightness or stiffness within the joint itself. It's the muscles that limit the range of motion, and then pain. I hope this helps. I wish you all well on your healing journey. And as always, feel free to contact and comment me and Sam within the group and tag us. And we'll do our best to answer all your questions. Have a good day, and I hope it's good.